Premal, thank you so much for joining us to help teach other people what you learned, which is how to be a successful early career researcher.
Thank you for having me. I learned a ton through the program here.
Thank you so much.
Yeah, I'm eager to share.
Well, Joe and I are here as two ends of the spectrum. Older, wiser, experienced, and early career new, to learn some of the tips and tricks you've learned. So one thing we're starting with everybody is just getting some wisdom on how you write, because we are interested in grant writing, and some of it is just words on a page. Do you have any strategies that work for you to do that?
Glad you asked me that. I'll start with what I used to do, and I think this is a common approach, is most of us, before we start writing, we think, and we have a number of thoughts. Usually when you're writing a grant, this is something near and dear to us. We care about it deeply. We've thought about it for weeks, months, maybe years. So there are tens, maybe hundreds of concepts we want to get down on paper. And what I used to do is just start writing and then review paragraphs and then edit them. And what I'd start with was a bunch of stuff that gets down to the essential concepts over a period of time. It was this iterative process. And then I realized, through this program, that a better strategy, and this is what I do now, is when you have all those concepts in mind, start with a framework. And the way to think about it is really there are concepts and then there are details. And often the details can get in the way of explaining concepts. So thinking about for any given section, thinking about the concepts first and how they tie in together, and what are the 4 or 5 most important concepts to highlight for any given proposal, starting with that first and just putting it down on paper and then fill in the details. That's really helped me organize my thoughts and focus on what's important.
That's really good. The other thing that makes me think, the other thing I like to do, similar to what you're saying, is literally space those sections out on a page. So even though when you start writing it'll make it wrap, but it helps me too if I know, okay, these are the 5 things I want in my background section, and I need to say something about this, and then you have a few other points you want to make. But then you sort of fall into the same trap, but you're like, and another thing, and another thing, and another thing. And you can hopefully use those paragraphs again. But if I know I'm going to allocate 1 page, which is about 500 words, single space, to this section, then it also is another constraint that sort of makes you prioritize. And then you can decide, if I don't have it here, is there any other place I can put it? I need the outline for the parts at the highest level. It helps me trim away some things that might not make it.
Yeah, that's a really good strategy, and one I haven't thought about before. And treating page lengths as a fundamental limiting block, because it is. I mean, maybe we would all be smarter if we had A1, as our default, but we don't. We have a practical limitation on length. Do you tend to start a little longer and adjust for editing down?
Yes, but you can, if you're 3 pages and you have to go to 1, that's going to be very different. It's a little bit of wasted effort and energy, and you might spin your story in a totally different way than if you only have this one, this much room. And
Makes
then
sense.
then you can always see, could you say it in fewer words, could you say it, and then as we do, you show it to somebody else and did I even pick the right sections, right? Is that story that I want to tell, the story I'm
should be
telling, right, that other people are receiving. Sometimes what I do, if I really can't decide, right, I'm so attached to all the little subplots of this story, and say I have 2 pages of content, sometimes what I do, like you, I've been thinking about it, it all makes sense, it's all important, I can't pick, they're all my babies, and so I give it to somebody else and say, what got you really excited about this? What were you compelled by? What is getting your emotion up about it? And often it's something I put further back. because to me that's not the most important thing, but I'm not the reader.
Yeah.
So
Yeah.
if they're like this, by the time I got to this section, bring it up.
Yeah.
Okay, well, okay.
Yeah.
Sometimes I'll sort of crowdsource that prioritization.
That's a really good point, and one that I think I've defaulted into with some of my early research experiences here, having a panel of experts that didn't have deep expertise in what I was doing. So the whole, I found that process a little bit jarring at first because I was used to the local ecosystem of other interventional radiologists who also, by the way, deeply care about the stuff that I care about. So I didn't, we make the same assumptions. And anyway, forcing myself to explain the concept to someone that doesn't really know much about it but cares to understand was a huge leap forward. And just what do you prioritize? What are the key concepts? What matters to most people is ultimately the process of science, the process of grant submission, the deliverables. We intend to add to the common understanding, the common good. And we often forget that because we think about our local microenvironment first.
It seems like you both covered that pretty well. But I'm more curious about, so you talk about reaching out to people outside of your specific niche.
Yeah.
Who does that usually look like, and why have you chosen those people in the past?
Yeah, I'm very fortunate. So I think I have access to physicians, PhD researchers on this campus. I can pick and choose people who are available, and usually folks are willing to engage and help. So let's work with that assumption first, that you have enough of a local milieu of clinical and research experts who can lend a few minutes to your idea. And, the very first step could be as simple as, hey, do you have a minute? I'm working on this thing, what is it? How does it sound to you? And I think you can often tell if they start getting excited about it or not. That's sort of layer one. And there are lots of, potential takeaways. One is the concept is good and the way you're explaining it is bad. Or the concept is bad and there's nothing you can do to spice it up, right? Right? But I think that quick micro shopping is helpful, and you just sort of pick intentionally, people you respect who think about science seriously but aren't connected exactly to your work. That's very helpful. Beyond that, I think it could be more of a getting feedback in the form of edits or at that point you're asking for 30, 60 minutes of their time. That's a smaller panel of maybe 3 to 5 people. And, if you have those people on campus, hopefully it's something that you can, have an indirect economy around. You can help them out when they need your help. And that way, you're co-investing time and effort into each other's success, But let's, that's I think a lot of places, and I've been very fortunate with that. It's not been difficult for me to find folks that way. Let's say you don't have that, right? You don't have hallway conversations with folks who are thinking about the kind of science you want to do. What do you do then? I would recommend the community of scholars is large, and most people are pretty willing to help. And especially if the engagement is a few minutes, a quick email, a quick Zoom call. I think institutional boundaries are melting away in the post-COVID era, and it's pretty easy for folks to start doing meaningful collaboration and conversation across institutions. So that's the other strategy, is just pick out maybe a list of 5 to 10 people who could be potentially helpful, again, in a just adjacent to you space, right? Not in your space. And then, start with just a couple emails, see if you can solicit some conversations. I hope that.
Yeah.
I want to build
Yeah.
on what you're saying,
Yeah.
because it sounds to me like you're suggesting, as you think about what do I want to write a grant about, I've got this idea, to have verbal conversations with people just to bounce off the idea. What do you think about this? What do you think about this? Where you're not invested in a written document form of the idea. When you're just idea shopping, shaping it, seeing what resonates.
Yeah.
I like that. I think there's a lot to say it's one thing to like have it in your mind.
Yeah.
The next level is to try to say it to somebody else and pay attention to the questions they ask you.
Yeah.
And if they're like, yeah, I don't know what you're talking about, like
Yeah.
interventional, what?
Yeah.
Okay, well, like, let's try it. And you keep refining every time you talk with someone, you're going to have refined the pitch.
Yes.
And so that sounds highly valuable. And like you say, 30 minutes is real. It might be 15, it might be 30. Buy somebody a cup of coffee, have a
Yeah.
quick Zoom call. Can I bounce something off of you? Most people are quite generous with something like that. And then when you feel like, all right, I think I might have something, now you got to write it down.
Yes.
Because you're not going to get a grant by talking.
Yeah.
It must be in written form. Then you have a different level of reader.
Yes.
So, I mean, that makes a lot of sense. And that's probably, it feels less challenging to the early career researcher to just talk it out with somebody.
Yeah. A hallway conversation as a starter is a low bar. And if it's, if it doesn't lead into a 30-minute thing where there's back and forth engagement, it's okay, you walk away. Eventually, you're absolutely right. It has to translate. If you have a few positive interactions that way, it has to translate into organized thoughts on paper to get some feedback on.
Right. Okay, can I build on this? I have a different question. One thing that I have come across, and I'm sure you have too, as you in your own career or when you mentor people, when they're passionate about something, they're into something, whether it's health equity or population health, whatever, and they want to get a grant to study that area. How do you go from the big idea to something that turns into a right-sized grant proposal?
Yeah. We all fall prey to the pull up a chair. I'm going to tell you about this thing for an hour or two because I care so deeply about it, right? And that really, it's a good place to start because that means we're engaged. But we just have to be really mindful of that. All of us, when we choose to study something, we care about it more than most other people, right? And the idea then is to think about how do you get other folks to understand and be engaged, maybe not at the same level, but at a high level. Getting from this idea of, let's say you're really invested in a space. And that was my experience. I felt like a fraud for so long, and I still do in many ways. But one of the ways in which it's true almost on a daily basis, you talk to somebody and they're doing the 10th study on something, and they seem like they're so focused and they're on their way, and the next step is really obvious, and the one before it is really obvious. But, my story was, it wasn't obvious to me exactly how to order the steps, what to focus on within the larger problem. So let's think about it sort of in a more concrete way. You want to impact, let's say, a disease or a certain population. There are probably a number of gaps or problems that need to be addressed. A good place to start is just to, write down concretely what is the exact gap, what is the problem. There may be a disconnect between how we experience the problem, right? Like when we're talking, oh, this thing comes up all the time, or this population really struggles with problem X. Well, what does that actually look like in terms of a scientific question or problem? Is probably the first place to start, because that really gets to the guts of the matter. You refine it to what is the unanswered problem, and then there's probably a number of them. It does at that point necessitate some prioritization. So we could probably get on a whole tangent about how do you prioritize your work in a practical way so that you do the things in the right order and maximize success. I think that's a whole other really, when you're looking at someone's career in retrospect, it's not obvious, but I think prospectively, there's some logic to just thinking about how what you're doing is what you care about and what other people care about, and by the way, is fundable.
Okay, could you give us an example with your own research or with somebody you've mentored recently so we can really think through these things in specifics?
Yeah. What I'm currently studying is the problem of IVC filters. They're devices that are implanted in people, and they're implanted in very high numbers. We think they help for a certain amount of time in a certain situation. And then for a number of reasons, we fail to retrieve them in a timely fashion, and often we just don't retrieve them at all. Well, if they just became defunct, it wouldn't be a problem, but they cause problems over time. So there's a real incentive for people to get them out. And this is a problem that manifests over a long period of time, and this is a sticky problem in healthcare when the risk is really accumulates over a long period of time. We do a bad job of focusing attention on it. So this has been known for 15, 20 years, and I wanted to tackle the problem, but I didn't know exactly how to get around it. So what are going to be my aims? How do I think about it strategically? Where I immediately sort of lost people is that my first set of aims, there was an RFA for my local, interventional radiology association, and I just thought of the top 3 things I wanted to do. I put them on paper, and I thought, obviously this is going to get funded. This is so important. And I've never received a quicker rejection. And I thought, okay, what did I do wrong? What I was doing is diving deeper and deeper into the problem. Let me quantify every little step in the process. So here's level 1, here's level 2, here's level 3, and surely by the end of it, we're going to solve this problem. And what I was failing to do is really think strategically about the breadth. I was going deeper and deeper, and that's a very natural, I think, way we think about things. Is we go, I'm going to study it to the nth degree, and I will become the world's expert on it, and that's how the aims follow. Instead of thinking about how the problem it's not an IVC filter problem. It's actually maybe a problem about how we track devices. Are there other devices that fall into the same problem? It's not an interventional radiology problem. This is a healthcare system problem. Urologists, by the way, have the same problem with double J catheters, which is a whole other type of device. That sort of pivot, similar principle. That pivot was really crucial in helping me understand how to think about the concepts of the problem appropriately. The other way to think about it is really, it's actually how we process information. Is we think that we collect deeper and deeper information and then we organize it, but actually the way the brain works is we receive information and we try to tie it to other stuff we know. It's this whole network, the integration of information. I think it's the same process with grant writing. Think about the breadth of the problem and sufficient depth in first thinking about it and then constructing the aims. And then the final piece to that in a really practical way was what's going to get funded, right? So certain things I can do here and are of little interest to the IR Foundation, for example, versus the NIH. So I wanted to do a mixed method study. I wanted to understand the quantitative, the qualitative, how they come together. What are the factors underlying, whether we do a good job or bad job with IVC filter retrieval. And what I realized is that the quantitative piece was going to be of high priority. It's aligned with the interests of the IR Foundation I was working with. Maybe the implementation science part of it, the qualitative piece of it, maybe less so. And that only, if I hadn't really spent time thinking about that up front, it would have been a less successful effort. The NIH, certainly the implementation science part of it, the mixed methods, all resonated. So the concepts could be good. You also have to think about, does it align with what the foundation or the NIH study section is trying to get done?
Right. So you want to, and just from a practical perspective, once you're out of career development award space, which is 5 years, most of your time, usually 75% of your effort, so it covers so much, but in your life, you're going to usually, if you have a research career, have 1, 2, 3, 5 active projects at any given time. So you need a portfolio of studies. Some I think that you're running, some that you have a trusted other running, some that are foundation funded, local funded, federally funded. You're always trying to hedge against, sort of gaps.
Yeah.
And, some foundations, if you go to an interventional radiology foundation, well, you don't have to defend that intervention then,
Yeah.
right?
Yeah.
They're going to be like, this is what we care about.
Yeah.
Then you might be defending the approach,
Yes.
right? Like, oh, well, this is really why we want mixed methods here. I know
Yeah.
you care about
Yeah.
quantitative, but we want to bring in this other thing.
Yeah.
Whereas if you go to a different kind of funder, NIH, they are very interested in that pattern. You're saying, I want to study this particular filter, but we're going to learn so much about this whole class of problems in all of healthcare. It's highly generalizable knowledge, and a funder like NIH is going to love that stuff up.
Yeah.
Right?
Yeah.
So it's really sort of picking the thread of the problem that lines up with what these funders care about.
You brought up a lot of really good points. Can I ask you some
Yeah, for
to,
sure.
to expound on some? One is the idea of this portfolio. You're talking about, there's a certain number of projects that come together to make, I'm putting words in your mouth here, but to make a whole career or a sustainable career. You talked about funding gaps. That's a really good way to think about it, and not an easy strategy. I don't know if you have a balance in mind. When I think of portfolio, I think about financial investments. Do you think about grant projects similarly? Do you have a little sure bets and smaller ones and bigger ones and more ambitious ones?
Yes.
That's one whole thing I wanted to bring up.
Yes.
Yeah.
I think of portfolio in the financial sense too, and where you're balancing risk and reward, right?
Mhm.
And I always thought you should have also a portfolio for your manuscripts, right? Like there are some papers that you should just be able to do with data you already have. It's not controversial. You're just going to do a new analysis. Nobody's going to argue with you about it. You don't have to get special permissions. It's easy and it's publishable.
Yeah.
So that's just, you're not going to get in a top journal doing
Mhm.
something like that, but it will be good work. So that's low risk, low return.
Mhm.
And then there's some that are you're going to propose a prospective study, you're going to do data collection,
Mhm.
maybe you're going to do a randomized trial. You have no idea if it's going to work.
Yeah. Yeah.
Many things could happen, but if it did work and you do execute, that's the kind of study that's published in the top journals.
Mhm.
It will be harder to do, but it'll probably really pay off, and it'll take longer. So these low risk papers could be it'll take you 3 or 6 months to write a paper. Great. This could take 5 years.
Yeah.
Right? But you can't only be doing, trying to hit home runs, so to
Yeah.
speak.
Yeah.
You can't only have 1 or 2 papers every 5 years. You need a track record, and then there's things in between where you're partnering with somebody else. They've got something already going. You got middle ground stuff.
Yeah.
And in the same way, I would think of grant funding, always more money is better, but more money, more prestige is usually more competitive. So you're going to get rejected more. That doesn't mean you shouldn't try for it, but then you need to go for the groups who know you, love you,
Yeah.
your professional associations, maybe a regional association. Sometimes there's the Colorado Hospital Association or whatever. Internal money, your Clinical Translational Science Institute, your cancer center, those people will favor their locals.
Yeah.
So those are lower risk. The lower reward, but very important.
Mhm.
And
Mhm.
and I think foundations are somewhere in between.
Yeah.
They're usually very mission driven. So if you can line up with their mission, it's a great opportunity.
Yeah.
So I think you should always be mixing and then layering that in. There's always the ones that you lead, and then you're always looking for your key trusted partners
Yeah.
to lead,
Yeah.
because you can't be doing it all yourself.
Yeah. This gets at two other things that I learned more recently, which is one, know your funding sources. And it takes a little bit of time and probably investigation, is thinking about the priorities of the various funding organizations locally, regionally, nationally, and then getting a network of collaborators. And we often think about early in our careers, we put all this effort into building up a career, and we think less about how do you expand so that you can have a network of collaborators throughout the research process, but also to assist with adjacent work that you could lend a little bit of expertise to. That's critical, I think, to sustainability long term, not something that we think about early on.
I guess Joe's been curious, how do you pick those people?
Yeah. Well, before I ask that, I was curious about, you said figure out what the sponsor is looking for, whether it's locally or regionally.
Yeah.
How are you doing that? Can you explain that a little bit?
Yeah, I'm going to struggle with being eloquent here. I think, you could start with, like the NIH, for example, has, there are specific calls for things they're going to fund, and it's a targeted priority. Right? That's easy. Foundations often have annual strategic priorities, so they'll list off between 5 and 10 things that they care about, and you got to think about whether your problem fits into it. And then the other really practical thing is to just look back at what they've already funded as a predictor of what they're going to fund in the future. So certain organizations maybe care about a topic that you deeply care about, but they've never funded the methodology you're pursuing or the specific, where they just don't necessarily invest expertise or knowledge into it. And so you're not, likely to get someone who gets it on a review panel, and that can be an immediate hurdle. So I've, to the extent that I've done it successfully, it's been through intentional effort in those domains. Maybe there are better ways to do it, and probably over time, you learn more and more and more as you go along. You just get to know the kind of things that certain foundations fund, and what are the trends in NIH funding for different institutes, that kind of thing. Mm-hmm. Asking people, certainly again, the hive mind is always stronger, and so asking people, what their experience has been to learn from it is also hugely valuable.
And so once you find an organization that lines up with what you're trying to do and you think it's a good fit, and you're sort of, whether you're the PI or you're sort of just a part of the grant, what do you look for when it comes to what kind of team you're looking to work with, or somebody you're trying to choose for your team? Are there common characteristics that you're usually on the lookout for when it comes to that?
How do you form a team? I'll tell you really practically, just to ground it in my experience currently, my three aims over a 5-year period all have to do with different methodology, and that's intentional, right? It's a career development award, so aim 1 is quantitative, and my team involves theirs is very different than my team for the qualitative aim. So it's not one team. It could be methodologically specific or specific to the thing you're pursuing. So a certain amount of breadth, again, going back to the idea of, being in the research environment at an institution and knowing what people do and what methodology, what expertise you can borrow from is really helpful. But to be specific, the quantitative team, it really flows from what are we trying to get done. So unfortunately, I can turn to the chairman of biostats, who, I've worked with his mentees over a number of years, and I would love to hold on to the great relationships, but it's not possible, right? So one practical thing is I just go back to Dr. Ghosh and I ask, hey, do you have someone like this other person I worked with a similar set of expertise? And then I just look for personality fit. Can I work with, I do Zoom interviews, and I just do bite-sized pieces first, like a small something, to get a sense of how we're going to work together. That's sort of in the ideal circumstance. Sometimes you don't have, sometimes you don't have that choice. Like you got to find that one person. Yes, exactly.
Like, there's only one person on this campus doing this
exactly.
thing. And you're like, okay.
Yeah,
so.
yeah. You just got to figure out a way to make it work. So I think the teams are shifting for me quite frequently. Maybe certainly yearly they tend to shift as the focus on things shifts. But the general strategy is, know who's doing what. Try to get the best people in that space. That's been, ideally I want everybody smarter than me on my team so I can, rely on their deep expertise and pull it together, orchestrate more rather than, drive. And then, think about where the project is evolving and keep pulling in experts in that direction.
So when it comes to research and grant writing, what's your favorite part about it? Did you think you would be doing this when you were going through school? Like, how did this even become a thing?
I think a lot of us get really hooked to the sort of intellectual exploration that is at the core of research. It manifests in a lot of different ways. It manifests immediately with the excitement of thinking broadly about a concept. Day-to-day work, you're so focused on executing the day. If you're a clinician like me, it's really, let's fix the problems that my patients are presenting for that day. It's very narrow, it's focused, it's important. Very rarely do I get to think about how all these problems connect and what is the bigger underlying issue with a certain disease state or a certain patient population. So that in and of itself, to me, is really rewarding, is just the liminal space that it provides, just thinking about the problem and in a big picture, pattern recognition, integrating it over a period of time, sort of discussing it with experts. And then the other piece is, I've really come to enjoy the process of grant writing, which probably sounds crazy to a lot of people. Is that, going from a concept to a story, it's really storytelling. It really is. And how do you tell a good story to the right audience? That's really fun.
Mm-hmm.
So as a clinician, how do you find time to write grants?
If you figure that out, if anybody figures that out, it's so challenging, and especially as the clinical enterprise gets bigger and bigger. One of my mentors said, it's academic medicine. Academic is an adjective. You're doing medicine first, and we all take that seriously. We have to provide. I have a list of patients that need my attention any given day. So there's actually, at some point, you can get busy enough where it can feel almost wrong to take that time and space, because you could be devoting your time and efforts to helping the patients in front of you. I think ultimately creating some structure is probably the common denominator for some time and space alone to think about the bigger problems. To create time, you have to have structured time for research. And then, all the other things we've talked about fit into that space. So ensuring that you're physically away from the clinical space, and that you have the time and space to think about a problem, and then to engage with your network of collaborators, your ideas people, to run concepts by. Those are both, I think, really important.
That's great. I think the entire healthcare and research enterprise needs us all. Right? Actually, we need the people who live and breathe education.
Yes.
We need the people who live and breathe discovery and development. And we need people who every day in every way are patient-facing, and that is what keeps them going.
Yeah.
And it actually is the mix of all the things that makes it go. Because, as you know, the field changes so fast. I mean, day to day, there's new discoveries. Everybody's a learner, but somebody's got to be developing the next thing and bringing in the next thing, or you're out of date immediately, and then those clinicians are not giving top-level care. So, a learning health system and all, but somebody needs to contribute to the generation of new knowledge.
That's such a good point. We need all the phenotypes. We need our educators and researchers, and the magic happens at the intersection. Right. Creating thoughtful opportunities for intersection is really, that's, I think, where the distinction happens between programmatic success and failure. Is how often can the people who can really think deeply about research methodology, for example, intersect with the people on the clinical end who are clinical scholars but don't have a full-time devotion to research. How do those collaborations happen? You probably have great, you've got surely insights on that. It's not an easy problem to solve.
Right. I think it's one slice of diversity, frankly, and inclusive excellence. It's not just your background or your education or your experience, but it's literally like your disciplinary training, or just what your passion and care and concern is. If you thoughtfully, just as much as you want to find your content expert mentor and the people who are like you and the people doing your research, I think you always want to know the opposite. So like if I have a PhD mentor, because I'm a PhD, I 1,000,000% need a physician mentor. And if I can get a nursing mentor, great. And then if I have a female mentor, I need a male mentor. These are different perspectives, and so if you thoughtfully expose yourself to all these different ways, it does really enrich, of course. And I think it gives you see new ways to bring people together.
Yeah. You're talking about having a team of mentors or and people thinking about how people individually add up to more than the sum of their parts. It's a good formula for success in really anything, clinical research, education. I'm not sure I've thought about it so intentionally, but it totally resonates.
Thank you so much, Premal.